Hi there, Dr. Rahi Victory, and one of our brave YouTube viewers has asked us the question of how difficult it will be for her to conceive when she's 50 years of age. So very soon we're going to be releasing a new YouTube video, you'll find the link right there, where we talk about what we call embryo math. And what you need to understand here is that embryo math is critical to understanding what your success rates are. I'll give you a very brief understanding of this so that you can kind of figure this out for yourselves. There is what we refer to as an attrition rate at every step of the IVF process. What does that mean? We're going to lose a few percentage points or eggs or embryos with each step of the way along the path from you growing your eggs to we have a genetically normal embryo. So let's take those steps. So number one, how many eggs are you going to produce? Number two, how many can we fertilize? Number three, how many will grow to the blastocyst stage? Number four, how many are genetically normal? And then number five, how many does it take to actually get you one live birth? So at the age of 50, what we do know is that over 90 to probably 95% of your eggs will end up being genetically abnormal, or at least your embryos will end up being genetically abnormal. So we need to do backwards math in order to figure that out. At most, you're going to produce one, maximum two eggs, unless you have very, very unusually potent ovaries. So if you're producing one or two eggs, you're going to end up with one or two embryos from fertilization. About half will make it to blastocyst. So let's say if you made two eggs, you're going to end up with one blastocyst, and that one blastocyst has a 95% chance that it is not normal. So realistically, you would need to do the IVF process around 20 times in order to end up with just one genetically normal embryo, and you need three to get a 95.2% chance of a live birth. So at the age of 50, the likelihood of conceiving with IVF is negligible. I hate having to tell that to patients because I want the very best for you and I want to try with your own genetics, but the reality is that to tell you otherwise is to not inform you of all the details and all the information. Is there a chance? There is always a chance. But is it likely that you will succeed on the first try or even the 7th or 10th try at that age? Unfortunately, it isn't likely. You really will have a difficult time succeeding, and it can take multiple tries before you actually end up with one successful outcome, even if it occurs at that point. So do we recommend at the age of 50 that you try IVF? I really do not. I would normally tell patients that at that stage, the chances are so low, it's probably not worth trying and they should strongly consider donor eggs. Will we try for you? We will. But do I think that it's prudent? No, and I'll do everything I can to try and explain the risks and benefits of all the options to you so you can make an informed choice. I hope that helps. Make sure you watch that embryo math video. It is critical to understanding this process. Again, the link is up there on the video here. Make sure you click on that and subscribe. You'll be able to see all of our programs.